Dr. William Whitmer here with Aurora Bay Care. This is something everyone needs to know about, the difference between a heart attack and heart failure. Do these sometimes get confused?
Very often they get confused.
Why is that?
Well, they have similar words and people get confused by that, I think. A heart attack occurs when an artery that feeds a part of the heart gets blocked and limits blood supply to the heart, causing heart damage.
Okay.
And then heart failure occurs when the heart can no longer adequately pump the blood to the body that it needs, and pressure and fluid backs up, causing heart failure.
Is one more common than the other?
They're both about equally common, and heart attacks are one of the most common causes of heart failure, actually.
Oh, okay. So can we talk a little bit about the risks for each? Let's start with heart attack. Who's at risk for a heart attack?
So the risk factors for heart attacks, and they do overlap with those for heart failure also, include high blood pressure, high cholesterol, diabetes, smoking, family history of heart disease.
Okay, and then now we look at for heart failure. And like you said, somewhat similar.
Very similar. So high blood pressure, being overweight, as we age, the risk for heart failure increases, and if you've had heart attacks, your risk for heart failure increases.
Now, these are all things it seems like, you know, besides this one with the age and things like that, you can control. Is there anything out of your control?
There really isn't anything but age. Even family history, I think, is really in your control. You can't choose your parents, but studies have shown that even if you have family members who have died early from heart attacks, if you live a healthy lifestyle, you can mitigate that risk.
Right, kind of prevent it, it seems like. What are some of the heart attack warning signs that we should kind of be on the lookout for?
The main warning signs are discomfort, and it's usually anywhere above the abdomen.
Right, and like we've talked about before, difference between men and women for heart attack.
Sure.
Okay.
So women often have milder symptoms or more what we call atypical symptoms. So the symptoms from a heart attack can vary a lot. They can be extremely mild and subtle, or they can be extremely severe. You can have a heavy weight on your chest, like someone standing on your chest, or you could have just light jaw pain, or jaw discomfort, or pain right at the lower part of the chest. Other symptoms would be fatigue, decreased exercise tolerance, shortness of breath.
And what about heart failure? Some of the warning signs
there. The warning signs of heart failure, so there are things that happen when the heart pump can no longer pump blood forward. So fluid backs up and you have what's called congestion. Fluid buildup in the body and the abdomen and the legs, or fluid buildup in the lungs. So that causes shortness of breath, edema we call it, or swelling of the legs. Inability to breathe when you lay flat at night, or fatigue also. So
any of these things, I mean, what do we do at that point when you might be feeling some of those?
If you have any of those symptoms, you can get to your doctor and have it evaluated. If you have a new discomfort in the chest or arm or neck that you've never had before, you really should get to the emergency room immediately, because even if it's subtle, it could be a heart attack. And we find with women that they often don't get diagnosed as quickly, and they often don't go to the ER as quickly as men do.
Because it's not your classic symptom of just the chest pain there.
Right.
All right, so immediately, if you're feeling any of these, get help.
Correct.
All right, thanks so much, Doc. There's so much more information to cover here. For more about heart attacks and heart failure, just visit our website and click on the Wisconsin Tonight tab.